Okay, you can go ahead.
Ready? Okay. So what we have here are all our laryngoscopes that are Huja. And the commonality amongst all of these is there's always the handle. Everyone has a light cord. And everyone has a light carrier.
Yeah, I got it.
Light carriers are
No, it
different
just came
shapes,
down.
like this one, or this
One
one.
of them gotta go up before
Or
it
it can be like this one.
Oh, fine.
So they consist of three parts: the handle, the light carrier, and the light cord. These are all we have. So we've got two standard Dito scopes. They're identical. We have the two Dito Fraiche that's got this fancier sort of light carrier on it. I've got one here put together. Here, let's separate it. This is the Dito Fraiche. This is what the light carrier looks like on this one. It's two pieces, like this. Here's what it looks like put together. So when the surgeon puts this in the patient's mouth, the purpose of this is to pull their tongue out of the way. So their head's here, their body's down here. They do this to pull the tongue out of the way so they can see the voice box, the larynx, and see if there's a tumor there. So a lot of people that are hoarse and they speak, and you could sound like they have as they say, a frog in their throat. They're looking at the voice box to see where if there's a tumor or there's an infection in there, or there could be bleeding, polyps, things like that. But they can't see without getting the tongue out of the way. So that's the purpose of this big old blade. Patients are always asleep. You could not tolerate this if you were awake, because that's where your gag reflex is. So they all have different purposes. This one, what's interesting about this one, you can only look at this one with one eye. So when they're looking down, they look like this, and it really zeroes in on the spot they want to see. But this one has a real wide hole, so they can actually look at it and see with both eyes open through it. It's a surgeon preference. So each one has a light carrier, a cord, and a handle. And that's basically all there is to it. The trouble is, they're very specific to each other, and they have to stay just like this. Because like I said earlier, they used this in the emergency room over the weekend and the parts were mixed up. It's nobody's fault, but when they took the tape off of everything, that's how things kind of got mixed up. So we just have to go with taking pictures to keep everything matched up.
Yeah, so I have pictures, color pictures of all of them fully assembled. So then that way you can reference what you have on the tray based off of what is supposed to be together. And you can see all the individual pieces as they are.
And
so that should help, since the tape's not there, to just automatically.
How does that work? I'm sorry.
this one, when you go to put this together, when the surgeon goes to use it, let me think, like this. And it's a handle for him to use.
Okay.
Like this. And the patient's body's down here, and he's going like this, and he's looking inside. And the light in all of these is down the side, so they can light up with each cord. So really, the scopes are useless without a light cord, and the light carrier carries the light. It's pretty simple thing. So if they're missing something, there's no sense in even putting the tray together, because you can't have one without the other. They all work together. So that's about it on these. We finally got them in place again, and it's nobody's fault. I believe it's because of the tape is gone. It's been hard for us to keep them in. And some of these we rarely use. There's those two big boxes that we sterilize, those direct DL trays. Those are Dr. Razai's favorite. And basically what they are is this one, the Dito, is in there. He uses that most of the time. So these don't get open very often. So once they do get open, we don't find out they're mixed up until we're in a situation where we really need them. So this picture idea is a good idea. And if anything's missing, just tell somebody, and don't put it up, because we won't know until we go to open it that it's not, we can't use it. So basically that's what it's for, and your larynx is right at the top of your at the back, way back at the back of your tongue, where your gag reflex is. So that's what they're looking at, is the voice box, to see what's going on there with the patient. Sometimes they'll have difficulty swallowing. They'll be bloody. They'll be coughing up blood, and it might be some things like that. that they don't need to see all the way down into the lungs, they just need to see in that space past your tongue. So,
And then these live on the airway cart upstairs.
all of them fit so far on the airway cart. And that's a great place for them because when you need that airway cart, the light source is right there where you can plug it in and plug it into the wall and turn on the light. So everything's there for them to use it. And there's some graspers in there. If they need to take a biopsy, you can take a biopsy through this because it's wide enough. You can put a little biopsy forceps down there. And pretty much everything they need is on there once these guys are all put up and put in the drawers. So
And I did make sure they all do say OR airway cart. There is the one, I think the one that's down, because the bivalve is the one that says, I think, cart.
that needs to be airway cart also.
Yeah, so, okay.
We'll find a way to fit them all in.
Yeah, so just in case something happens and you don't know where it's at, it's up in the core, right before you go into like where Katie and the control desk is at. It's the little blue cart.
Where they're next to the red crash cart.
Yep.
Because they're both kind of emergency carts.
Yep. And then they'll just go onto that
And
cart.
everything will be disassembled when we send it.
Absolutely. The one I put together here was just to show you what these two pieces look like put together on here. So they have unfortunately that's how things get lost, is we have these small pieces, but you can't put them together and sterilize them. They wouldn't be clean. So just like everything else that you leave box locks open and everything, you would have to do that with this.
And that is how I took the pictures. I took the pictures with everything disassembled. So,
So questions?